Coronary artery disease, or CAD, is one of the leading causes of heart-related illnesses and deaths worldwide. It develops slowly over time, often without noticeable symptoms until a serious event like a heart attack occurs. But what exactly causes this condition? How can you recognize the warning signs? And most importantly, what can be done to diagnose and manage it effectively? In today's video, we'll explore everything you need to know about coronary artery disease, its symptoms, how doctors diagnose it, and the best ways to manage and prevent it. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Coronary artery disease occurs when the arteries that supply blood to the heart become narrowed or blocked due to the buildup of fatty deposits called plaque. These deposits are made up of cholesterol, calcium, and other substances that accumulate on the walls of the coronary arteries. Over time, this process, known as atherosclerosis, reduces blood flow to the heart muscle, depriving it of oxygen and nutrients it needs to function properly. When the arteries are partially blocked, the heart may struggle to pump efficiently, leading to chest pain and other symptoms. If a plaque ruptures, it can trigger a blood clot, which can suddenly and completely block an artery, leading to a heart attack. This makes CAD a serious and potentially life-threatening condition, but with early detection and proper management, it is possible to reduce the risks and improve heart health. Many people with coronary artery disease may not experience symptoms in the early stages. The condition can progress silently for years before symptoms appear. When symptoms do develop, they typically occur when the heart is working harder, such as during physical activity or stress. The most common symptom of CAD is chest pain or discomfort, also known as angina. This can feel like pressure, tightness, heaviness, or burning in the chest. Some people describe it as a squeezing sensation, while others mistaken it for indigestion. The pain may radiate to the shoulders, arms, neck, jaw, or back, and it usually improves with rest or a medication like nitroglycerin. Shortness of breath is another common symptom. When the heart isn't getting enough blood, it struggles to pump efficiently, leading to difficulty breathing, especially during physical exertion. Some people may notice that they feel unusually fatigued or weak even with mild activity. In some cases, CAD can cause palpitations, where the heart feels like it's racing or fluttering. Dizziness or lightheadedness can also occur, particularly when blood flow to the brain is reduced. One of the most serious signs of CAD is a heart attack. Symptoms of a heart attack include severe chest pain or pressure, pain spreading to the arm or jaw, nausea, sweating, and shortness of breath. Some people, particularly women, diabetics, and older adults, may have atypical symptoms, such as fatigue, nausea, or back pain, without classic chest pain. A heart attack is a medical emergency that requires immediate attention. Diagnosing coronary artery disease involves a combination of medical history, physical examination, and diagnostic tests. Your doctor will start by asking about your symptoms, lifestyle, and risk factors such as high blood pressure, high cholesterol, smoking, diabetes, and family history of heart disease. A physical exam may reveal signs like abnormal heart sounds or swelling in the legs, which can indicate heart problems. However, because CAD often develops silently, additional tests are usually needed to confirm the diagnosis. One of the most commonly used tests is an electrocardiogram, or ECG. This test records the electrical activity of the heart and can detect abnormalities such as irregular heart rhythms or signs of a previous heart attack. If a person is experiencing chest pain, an ECG may show changes that suggest reduced blood flow to the heart. A stress test, also known as an exercise test, evaluates how the heart functions under physical exertion. During this test, the patient walks on a treadmill or rides a stationary bike while their heart rate, blood pressure, and ECG are monitored. If exercise is impossible, a medication can be used to stimulate the effects of exertion on the heart. Another important diagnostic tool is an echocardiogram, which uses ultrasound to create images of the heart. This test helps assess heart function, identify structural problems, and detect areas of heart that may not be receiving enough blood. For more detailed imaging, doctors may use a coronary angiogram. This involves injecting a contrast dye into the coronary arteries and taking X-ray images to visualize blockages. This test is performed using a catheter, which is inserted into a blood vessel in the wrist or groin and is guided to the coronary arteries. If significant blockages are found, immediate treatment such as stent placement may be performed. Other imaging tests such as CT coronary angiography or cardiac MRI may also be used to assess the condition of the coronary arteries and detect plaque buildup. Managing coronary artery disease involves lifestyle changes, medications, and sometimes medical interventions to restore blood flow. The goal of treatment is to reduce symptoms, prevent complications, and slow or reverse the progression of the disease. One of the most important aspects of managing CAD is adapting a heart-healthy lifestyle. This includes following a diet rich in fruits, vegetables, whole grains, and lean proteins, while reducing saturated fats, processed foods, and excessive salt. Regular physical activity such as walking, cycling, or swimming helps improve cardiovascular health and maintain a healthy weight. Quitting smoking is crucial, as smoking damages the arteries and accelerates the progression of atherosclerosis. Managing stress through techniques such as meditation, yoga, or deep breathing exercises can also help improve heart health. Medications play a key role in treating CAD. Doctors often prescribe cholesterol-lowering drugs such as statins to reduce plaque buildup and lower the risk of heart attacks. Blood pressure medications, including beta blockers, ACE inhibitors, and calcium channel blockers, help control hypertension and reduce strain on the heart. Antiplatelet medications such as aspirin or clopidogrel help prevent blood clots from forming in the arteries. Nitroglycerin may be prescribed to relieve chest pain by relaxing the blood vessels and improving blood flow. In some cases, medications that reduce heart rate and workload, such as beta blockers, can help relieve symptoms. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, for patients with significant blockages in the coronary arteries, medical procedures may be necessary. One common procedure is angioplasty and stent placement. This involves inserting a small balloon into the narrowed artery and inflating it to widen the passage. A stent, which is a small mesh tube, is then placed to keep the artery open. In more severe cases, coronary artery bypass grafting or CABG may be required. This is a surgical procedure in which the blood vessels from another part of the body is used to create a bypass around the blocked artery, restoring normal blood flow to the heart. CABG is typically recommended for patients with multiple blocked arteries or those who are not candidates for angioplasty. Prevention is always better than treatment when it comes to coronary artery disease. Making heart-healthy choices early in life can significantly reduce the risk of developing CAD. This includes maintaining a balanced diet, staying physically active, avoiding tobacco use, and keeping stress levels under control. Regular health checkups and screening for conditions like high blood pressure, high cholesterol, and diabetes are also essential. If you already have CAD, following your doctor's recommendations, taking medications as prescribed, and making lifestyle changes can help manage the condition and prevent complications. Coronary artery disease is a serious but manageable condition. Recognizing the symptoms early, getting the right diagnosis, and making proactive changes can make a significant difference in your heart health. If you experience chest pain, shortness of breath, or other concerning symptoms, don't ignore them. Seek medical attention right away. Thank you for watching. As always, take care of yourself and make the most of your day.